Hey, it's Dr. Shelley, and you are scheduled for a hysteroscopy with removal of endometrial fibroids and or endometrial polyps using the TrueClear um, device. So this is very similar to when we do the hysteroscopy D&C. So some of the stuff that you're going to hear you from me now is you probably already heard when we did the hysteroscopy D&C in the office. But to refresh your memory, any procedure that was done, regardless of whether it's in the office or the hospital, pretty much has the same risk factors that we have to discuss with you. So let's just get those out of the way. So, of course, with any surgery, the risk of surgery includes the risk of infection. Remember, if you're a diabetic or if you have high sugars, then I will have given you an antibiotic. If I have not, and you are a diabetic or you have high sugars, then you need to let me know so that I can give you an antibiotic. Otherwise, we do not give you one. It actually depends on the size of the fibroid. So if there's a really big fibroid in there, I will put you on antibiotics, and I'll just send that over during the surgery if I haven't already given it to you. But little polyps or really small fibroids, then we won't do that. There's a risk of bleeding. We do use what we call the block, the local block, to constrict the vessels in the uterus to decrease the amount of blood loss that occurs during the procedure. And uh, um, there will be some bleeding after the procedure, but it shouldn't be copious quantities. The risk of damage to adjacent organs, your bladder's there, your bowels there, your ureter's there, your blood vessels are there. Remember the vagina, we're not trying to hurt your vagina either. Remember, we're going in with sharp instruments. That's how we are going to get in there, make sure everything's open, and then we are going to do the resection. So is there risk for uterine perforation with the resection? Yes, there is. But that's what makes the TrueClear so great, is that the old original resectoscopes, the cutting edge was at the tip, and so you could actually go straight through the uterus with this heated knife, and so that was not good. But now with the resectoscopes, the cutting channel is on the side, so it reminds me of a Pac-Man. That's exactly what it looks like. It's pretty cool. Well, it doesn't. That's what it reminds me of. I guess it doesn't look like a Pac-Man. But anyway, but it only can get a mass if there's a mass. Otherwise, it would just shave it because it's on the side. So if it's going along your uterus, it's just going to do a shaving. And so it's actually a very great way to do a hysteroscopy D&C because you're actually cleaning the uterus. So I will sometimes do that at the same time after we've gotten the mass out. But if there's a mass, then the mass will actually go into the operative channel, and it will chomp the mass up into pieces and dispose of it. And so it has to have something jutting out in order to do that. And so it's actually very safe. So if there's a uterine perforation that occurs, is usually when we're trying to get in to get started with the procedure, not like while we're doing the actual resectoscope. But once again, we have to tell you that that's a risk. Remember, there's a risk for blood clots in the legs. We call it deep venous thrombosis or DVT. If you had a blood clot in your leg and it broke off and went to your lungs, that's bad. That's a pulmonary embolism. Once again, the fluid we use to open up the cervix and the uterus to see inside the uterus, if that fluid ended up in your blood vessels, ended up in your lungs, that also is a bad thing. And with any surgery, there's a risk of death. Like I've told you before, you take your life in your hands every time you get behind the wheel of a car, and we do it several times a day, and God willing, we come out on the other end each time, thank goodness. This is a very simple procedure we do in the office all the time, and we don't expect anything bad to happen to you, but we have to tell you that those are all the risks that go with surgery. Um, as far as um, 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 what to expect on the day of surgery, the you are going to either if it's in the morning, you're going to eat your breakfast, and you're going to take the Cytotec, which is those two pills that help to open up your cervix the night before. Unless you're actively bleeding even a little bit, then we don't take the medicine. Or if we think we're about to bleed any second, then don't take the medicine. Otherwise, you can go ahead and take it. It may make you, remember, have a little bit um, of gunky discharge, and or it may start you bleeding. Regardless, if you've already taken the Cytotec and you're coming in, come on in for the surgery. We will continue the surgery even if you have bleeding after the Cytotec is taken. But if you are bleeding, like I said, don't take the Cytotec because that's all it does is to open up the cervix. So if you're bleeding, your cervix is already open. If your procedure is in the afternoon, you're going to eat breakfast and lunch, and the difference is you will take the cytotec that morning. Remember, you want to take your blood pressure medicines and any sugar medications and any normal medications that you normally take the morning of surgery unless they upset your stomach. Now, if your blood pressure medicine or your sugar medicine upsets your stomach, you still have to take those. I need you to have good sugar control. That actually helps with healing. And also, I need your blood pressure to be well controlled, or I will cancel your surgery. So, hopefully, you take your medications like you're supposed to on a regular basis, but definitely leading up to your surgeries, you should if you would like to proceed as scheduled. You want to bring your throw blanket, remember, and you want to bring your warm fuzzy socks because it can be really cold in the office, and it's better to have it and not use it than to be laying there for 2 hours wishing you had it. The procedure is actually a little bit faster than the hysteroscopy D&C, so you definitely, usually it's done in about 20 minutes, but remember, I need you there for 2 hours because we have to get you situated, changed, get the pain medication on board, and get everything set up. Then we do the procedure, and then if you're looking completely alert and oriented, then we send you home. If you're looking like you need to lay there for a little while, then we let you lay down. I do, if I have given you narcotic for any reason, bring it with you. If you're using anxiety medication and not using the laughing gas, then bring obviously the anxiety medication with you. If we gave you a prescription to use at home, and if you're using anxiety medicine and or narcotic, you need a driver. Now, we do not like the drivers in the office, so they basically can drop you off and they can go to Lowe's or go shopping somewhere, or they can go home as long as they pick up the phone when we call them back and say, come back and get you. And they need to know that they're looking at a 2 hour time frame. If you did absolutely, positively, beautifully when we did the hysteroscopy D&C with the nitrous oxide, then we can use the nitrous oxide again, and you don't need to have a driver. And usually, because I will tell you, oh yeah, you're great. You can get anything done in the office. Or I'll go, you know what? You didn't do so hot with the nitrous oxide for the D&C. We probably need to reach for the um, anxiety medication and other painkillers for the other procedure. So whatever I've already told you, we should stick with that plan because that's what was the best plan when we were in there doing the original procedure, right? Remember that the goal is to remove the polyps or the fibroid with this procedure, and that we can see significant improvement in bleeding when we do this. But if there is a nice big juicy fibroid in there, there is a possibility that we cannot get it all out at the one surgery. And so it is customary that with big fibroids that it can require 2, even potentially 3 of these hysteroscopies with TrueClear procedures to completely remove the fibroid. And that's not considered an error or anything like that. It just depends on the mass. But what's great is that it's still a very simple procedure. Recovery is still just one day compared to like having a major surgery like a hysterectomy. So it's still worth it. And even if it takes more than one try to get it out, when it's all gone, it's definitely a thumbs up. And everybody that's had it done it feels like it was a really beneficial surgery to have done. So I think that I am covering. Let's see, we already went over surgery stuff, eating, what to bring, pain meds. I think we're good. Is there anything else? If there's anything else that I've forgotten, oh, and people want to know when can they have intercourse after the procedure. You should plan to be out of commission for at least a week, and that includes tampons, and so plan to pull out some pads. But like I said, usually it's not too bad on the bleeding after these procedures, but you can anticipate that you'll have some. And I will be going over the post-op instructions in a separate video, so you can stay tuned and watch that. And I recommend you watch that before the surgery as well as after the surgery. So if there's anything else after you've watched this video, if you have any other concerns or questions that have not been addressed, then please feel free to talk to the surgery scheduler. If you still have questions that she's not able to answer, then she will track me down and get the answer from me, and or I will call you directly. So if you so that all of your questions are answered before you get to surgery. And so if you don't have any other questions, then I am going to be looking forward to seeing you on your day of surgery and getting this procedure done. Take care.